The 62 years gentleman who's a chronic tobacco chewer and smoker and a known diabetic, and has presented with this lesion for past 6 months, which was initially 2 into 2 centimeters to begin with and has rapidly progressed in size. And the patient also complains of swelling in the left cheek since 2 months. The patient is complaining of pain, and sir, on examination we can see, sir, there's an ulcer proliferative growth involving the left buccal mucosa, sir.
वहाँ से दिख रहा है?
So the growth, the ulcer proliferative growth involving the left buccal mucosa, it is extending from the angle of mouth left side, sir, till the last molar, sir.
See, the mouth opening is very good.
Mouth opening is adequate, sir.
No trismus.
Yes, sir.
Teeth are stained over naturally he has enjoyed his tobacco. And this is the lesion. Classical ulcer proliferative. You can even see that it is bleeding at places.
Yes,
These vessels. You can see neoangiogenesis.
Yes, sir.
And these are going to bleed easily. See that? This is a little tender, I won't hurt him. This is the induration, and it's not extending too far, although it is extending. And classically,
Retromolar trigon appears to be normal, sir, in
the
examination.
retromolar trigon is free, the
Yes,
lower
sir.
gingivobuccal sulcus is free, upper I'll just see.
So there are teeth also missing in the lower
The
jaw.
upper one, you know the reason for
So
the
left side, sir, there is a hard 2 into 2 centimeter lymph node at level 1B, and there are lymph nodes which are palpable at level 3 and also level 5 on the left side.
There's a big node here.
Yes, sir, 2 into 2 centimeter hard.
This
fixed
is level
lymph
1
B.
B. I showed you yesterday in the operation. You were there, so you know it. And 2,
And even 5 at
3 is there, yes. And there are level 5 nodes also, but not significant. Other
This-
side, ये थोड़ा नकाब हटा लीजिए अपना रुख से,
gauze piece is there.
ढीला छोड़िए,
So other side there
ढीला
is
मुंह बंद कर, मुंह बंद रखिए.
move fully.
Which is T4A. T4 is when the skin is involved. Otherwise 1, 2, 3 are based on size. 2, 4, more than 4. Easy? Breast 2, 5, more than 5. Repeat.
2, 4, more than 4, and if its skin is involved, and breast is 2, 4, more than 5.
T4 there also is involvement of skin adjoining structures. That is chest wall, under. Under is A.
A.
So T4A in breast. B, बाहर. तेरे वाली भाषा में. T4B skin. C is both. C is combined. A under chest wall, B बाहर skin breast. Both C. D is inflammatory breast carcinoma. That is breast. Don't confuse it. Here it is. 2 centimeters, 4 centimeters. Less than 2, 2 to 4, more than 4.
Contiguous.
T3. And then T4 is contiguous structures, which is divided into A and B. A is resectable, B is not resectable, but again trismus is resectable in some cases. So trismus can be due to muscles of mastication, masseter, etc. But pterygoid involvement would mean not resectable. Is that easy enough?
Yes.
So tell me T1, 2, 3.
So T1 is involved 2 to 4 centimeter,
Less than 2
less than 2,
centimeters.
and T2 is 2 to 4 centimeter, and more than this will not be resectable.
So T1 less than 2 centimeter, then 2 is from 2 to 4, then 3 is
More than 4.
more than 4.
Now 4 has nothing to do with the size.
Yes, sir.
I don't know why you didn't
It
tell
is
me.
it involves the skin.
No,
It involves the
involves
contiguous
contiguous
structures, surrounding structures.
The lymph node involvement is also there, which you should read about. Okay, I have discussed it in lots of my videos. So this patient has got so it's a diagnosis, Sukriti?
So 62 years chronic tobacco chewer with and a known diabetic with carcinoma carcinoma oral cavity involving the left buccal mucosa with cervical lymphadenopathy. Clinical staging CT3 T4A N1 N2A and MX.
Right? We'll tell you about the staging and all. Approach is exactly like you learned in the previous case. To investigations to confirm the diagnosis. Repeat.
Investigate, confirm the diagnosis.
मैंने जो बोला उसी का रिपीट करिए. Investigations to confirm the diagnosis.
Investigations to confirm the diagnosis.
Investigations to support the diagnosis.
Investigations to support the diagnosis.
Investigations to stage the disease.
Investigation to stage diseases.
And investigations to treat the patient.
And investigation to treat the patient.
Repeat all four.
Confirm the diagnosis. Support the diagnosis. Stage the disease and treat the patient.
This is an answer to all investigation questions. So to confirm the diagnosis, like we did there, edge biopsy, we'll do it from here. Not from the center, but from the edge. Imaging will support it. We'll do a CT scan of the head and neck to see the extent, because you have said T4. You will see how much is infiltrating. And ultrasound of the neck for the neck nodes, but CT will cover for the nodes. A distant metastasis, that is M. So history for T, N and M, examination for T, N and M, investigations for T, N and M, and treatment for T, N and M. That's the management of cancer. So we'll do the management in the form of wide local excision with clear margin, which will mean removal of the entire area, skin, soft tissue, and inner lining, that is buccal mucosa. And to reconstruct, we'll need all the three. So we'll need a myocutaneous flap, usually pectoralis major myocutaneous flap, which will have the inner lining as well as the outer cover, or PMMC for inner lining and deltopectoral flap for outer cover. Neck dissection, which you saw yesterday. All of you were there?
Yes.
So neck dissection will be done, which will be modified radical neck dissection type 2 or 3, followed by adjuvant radiation. That is the management of this case.